This is Steve Moreland from The Natural Upgrade. I'm talking to a very good friend of mine, Beshoy Amir, in Egypt. We're going to be talking about nitric oxide. Beshoy, come in here and tell us about yourself, tell us where you're at, and tell us why you decided to start this crazy journey into medicine.
First year medical student, actually doctor student. I'm going to start my internship years within about 2 months, as I say.
Okay, outstanding. That's exciting.
I'm very interested in compounds or materials that protect us from diseases such as diabetes, hypertension. Those diseases are the most common ones and actually are not curable by any way. You're just giving patients treatments just to decrease the symptoms, but actually we have no treatments. So I think the thing we can do is to prevent the disease, not just wait till we have the disease and treat it. We can't treat it.
So you really like the approach of being proactive and keeping your patients healthy as opposed to trying to fix them after they've become unhealthy and you're trying to get them back.
Yes. And actually the main problem is that I am actually not fixing them. I'm actually just decreasing the symptoms. Can fix,
I love that. Yeah. So you're saying that a lot of times it was something like diabetes or something that once the body is no longer healthy, it's hard to get it back to a position of healthy or homeostasis.
Yes.
Okay. So that's a very good motivation. So what got you to start on this journey of becoming a doctor?
Actually, I think there have been a research or something that says that medicine is number one in jobs that make you satisfied. When you are helping people to decrease their pain, decrease their suffering, you are satisfied. So I think the first important, and for me, as something I'm getting for this career is not money, that feeling of being satisfied.
Satisfied, that fulfillment that what you're doing every day matters. Wow. I love that. That is so amazing. That must be why you have that $1 million smile.
Thank you.
Let's jump in here and talk about one of these issues that you're saying that once we get into, it's hard to get us back to homeostasis or back to a level of health. And let's talk about high blood pressure. And this is a big problem for a lot of people. So tell us what causes hypertension. Let's start there.
Oh, okay. For hypertension, we have two main types. We can categorize every hypertensive patient into one of main types. Primary hypertension, primary, we can't figure out what is the cause, and secondary hypertension. For primary hypertension, the one which we don't know the cause of it, it's 90 to 95% of the cases. And for secondary hypertension, the one we know the cause of it, it's about 5 to 10% of the cases only.
Wow.
So the one with secondary hypertension, which we could find a specific cause and treat the cause, there are many causes like renal artery stenosis. We just ligate the stenotic area in the renal artery, and then the patient is no longer hypertensive. It's 5 to 10% of cases.
Wow.
But the major number of patients with hypertension are of primary hypertension. So I don't know the cause.
Wow.
So I couldn't treat them. I just give drugs that decrease their blood pressure. But because I don't know the cause, I couldn't treat them. So they would actually almost be hypertensive for life and would receive treatment for life.
Wow. Okay. Understand. Okay. So this is a much bigger diagnosis than I even imagined, because like you're saying, for the rest of their life, you're going to try to decrease their symptoms. But in actuality, 90% of the time, with all of the medical capabilities and technology we have, we don't actually know inside the body what's triggering it.
We don't know the cause of this patient, but we know risk factors.
Sure.
So if you have one of these risk factors, you are at higher risk of developing hypertension. If you have two, you are, of course, at a more high risk. If you have three, at much higher. But you could get hypertension with no risk factors. It's not probable.
Okay, cool.
So these risk factors may be aging, diabetes, not having enough exercise, sedentary lifestyle like of mine.
Sure.
Better.
Right. Got it. So you're doing a great job of teaching me already and teaching our viewers here. Thank you. Let's jump in and talk about this thing called nitric oxide and what exactly does nitric oxide do in the body? Maybe chemically, without going into a heavy chemistry lesson, what is that particular molecule doing inside this body?
Okay. Actually, mainly to just simplify, it dilate blood vessels
Okay.
in general.
Mm-hmm.
So it dilate blood vessels in my lungs. So I will be like breathing smoothly.
Mm-hmm.
It dilate my blood vessel all over my body. So
Sure.
I would be at a lower risk of developing hypertension.
Okay.
It dilate blood vessels in the main organ. So actually, it's how erection occurs. Nitric oxide is, you could say, it's the messenger of our nerves to the erectile organ in male.
Got it. Sure. Okay.
That's
So when
main-
you're talking about, you're using the word dilation. So if your blood vessel is at this level, dilation means it's going to increase it, correct? As opposed to constrict it. Okay. So it increases it. That gives it better flow, and therefore you feel differently. It causes a different feel in the body.
Yes, you would feel differently, but we could say, the main rule is not the feeling,
Okay.
but the long term of not developing hypertension.
I see. Okay. So you see nitric oxide as something that is good as a preventative option to keep you healthy so that you don't get into this place, like you said, where you're a primary hypertension and you're going to be on some type of symptom reducing pharmaceutical for the rest of your life. So this is a way to keep you from ever having to get there.
Yes, it has a big role actually.
I love that.
And some people who are doing bodybuilding have said that when they use nitric oxide, they have observed that they could have a better pump, could do a better workout.
So you're seeing clinical evidence that when someone does heavy lifting or heavy working out, that their stamina goes up, their strength goes up. What about their recovery after a heavy lift or a workout or something like that? What
I
happens?
have seen a couple of people reporting that the recovery time was much more shorter when
Got it.
they have used the nitric oxide supplement.
Okay, so I understand that. Have you seen anything when we start getting older, our bodies are aging? Does the nitric oxide naturally being produced by things like consumption of certain food products or exercise, do you see the production of nitric oxide going down?
Yes, actually, almost everything goes down when we are older.
Okay,
And one of them is nitric oxide. It's actually getting to decrease when we are at 30s and then decrease all over
sure.
till we are.
Okay,
So it's the decrease start at our 30s because it's produced through our endothelial cells.
Okay.
Maybe I'm going to.
that's
I
okay.
don't
Go
think-
ahead. It's okay.
The lining of our blood vessel is the main producer of nitric oxide. And these cells, as we go older, these cells go older and couldn't do its function or its optimal function, you know?
I see. Okay, so there's the reason why we see a reduction. Is it correct if I were to say that there is a nitric oxide deficiency in our body as we grow older?
I think it's a deficiency, yeah. Why
Yeah,
not?
sure. Okay, cool. So when was this nitric oxide? When was this discovered? Is this something new or has it been around for a while?
The role of nitric oxide in our body, when we know that nitric oxide had a role in our nerves and our cardiovascular system, was in 1998
Okay,
by a couple of professors. I know one of them. His name is Louis Ignero. He have discovered that nitric oxide has a role in our cardiovascular system. And the main role is the dilatation. Actually, it has a couple of other rules, but
sure.
are not the main.
Dr. Ignario, he discovered this, you said 98. Is that when he won the Nobel Prize for it?
Yes.
How does nitric oxide keep our hearts healthy and our blood pressure in check? Can you give me a little bit of a chemistry insight there?
So the role of nitric oxide is that dilate blood vessel. Dilate. So if it's like this, when we have enough nitric oxide, it's like this.
Right.
What's hypertension? Hypertension actually is that the blood vessel is very narrow. The blood vessel has high pressure, is compressed by this constricted or narrowed blood vessel. If I have enough dilatation, if I have enough nitric oxide, this would be very good for a hypertensive patient or very good for someone who wants to decrease the probabilities that he would get hypertension in the future.
I love that. Give me some simple, natural boost of someone that just says, okay, doctor, I don't want to end up as one of your patients. I would prefer to stay healthy. I want to be in that place of homeostasis. So are there some natural things that I could do to help me increase the nitric oxide as I'm getting older and the natural production is going down?
Great. Exercise
Okay.
have been related to increase our nitric oxide level.
Okay.
And something healthy is overall advisable to
Always.
not just increase your nitric oxide, but many other chemicals that would protect your health. But I would recommend specific foods if someone is interested in increasing the level of nitric oxide.
Yes.
These are beets. No,
Beets. Sure. Yes.
Yeah, I know that beets are very common in America. It has a lot of compounds that help our body produce nitric oxide himself.
Got it.
But there is no nitric oxide I could eat because actually nitric oxide is a gas.
Correct.
So I take foods that has 2 amino acids. Actually, I think I'm gonna to technical things, but these names of amino acids is citrulline and
Yes.
arginine.
Yes.
So if I'm recommending nitric oxide to you, I can't tell you to take a gas.
Sure.
You should eat compounds, foods that has citrulline and arginine.
Arginine.
Amino acids.
Okay. I understand. Okay. We always are being told, hey, we should eat more salads, right? And on the salads, we should have things like beets on there to increase the nitrates. That's what actually is chemically becomes the nitric oxide gas. It's the nitrates when we consume them. And then as we're digesting them, they give off the nitric oxide. Am my chemistry class correct? Is that good?
Yes.
Okay, cool. So I got an A today. That's awesome. So if someone is not following mom's advice, which was you should have a salad before dinner, you should have a salad before lunch, we're all busy and we don't have time. So tell me about the role of supplements when someone doesn't have time to take and eat the good raw vegetables.
Great. The first thing I would recommend is to eat vegetables and healthy diet.
Sure.
So it's the main thing. But I know many people couldn't get fresh vegetables every day.
Right.
Couldn't having the time to buy it. So if you don't have the time or can't get healthy food, so it's better to take supplements than none. Supplements that has L-arginine and L-citrulline, and your body will convert it to nitric oxide.
Perfect. You've given me some great insights, and I really love your perspective of how you approach medicine, which is helping individuals not become one of your patients, to help them live healthy, to get that exercise so that their body naturally produces the nitric oxide gas from walking around the neighborhood, maybe after dinner. Is that recommended, doctor?
Yes.
Okay.
Actually, as the exercise that we doctors recommend is just walking for 30 minutes,
Yes.
3 times a week.
3 times. Okay. Awesome. Okay.
So it's 30 minutes a day and 30 minutes the day after and 30 minutes the day after, and you are fine.
Okay.
Actually do it by just not taking a taxi or something. I just,
Sure.
when I have finished my work, I just walk to the home and
Okay.
I'm fine.
Beautiful. A little more exercise, taking that walk after dinner, maybe early in the morning when you get up, eating more salads to get those nitrates. And if you are not getting enough salads, don't feel that as you're aging, that nitric oxide is starting to and naturally reduce in our body just because it sounds like the cells are starting to get a little lazier and not doing their job. So we have to prop them up a little bit. And that's where you could take a supplement, like you said, that could have arginine or citrulline in there. And that will help keep you healthy so that you don't end up as a patient on the doctor's doorstep.
Yeah, I don't tell people to end their reservation. I like medical teaching.
Hmm.
I'm very satisfied when I'm teaching.
Sure.
I'm a student in Minia University.
Okay.
We have about 20 universities in Egypt, I think.
Okay.
It's one of them, but it have a big university hospital,
Okay.
which allow me to deal with a lot of patients and learn by just
Sure.
dealing with the patient, not just reading from the books.
Of course.
So I'm very glad I'm part of it.
Sure. Satisfied. Yeah, sir. I can tell that you love the education part, you love the teaching part, but you also like the practical part where you actually get to work with the actual patients themselves and hopefully bringing them $1 million smile after you have helped them, huh?
Thank you.
Yes, sir. I appreciate your time. I know you're busy doing so many things and making a difference in the world, but I wanted to thank you just for spending time with us and educating us, giving us some insights on what nitric oxide does and how it can affect the body and what we need to do to keep ourselves in that healthier state. And so I appreciate you sincerely. Thank you very much for taking time with us on the podcast on the Natural Upgrade.